trajectory continues. As we see the Omicron wave continue to wane, we know that you have many questions regarding what prevention strategies are really necessary for this moment, especially as people are so eager to remove them. At CDC, we provide public health guidance to help communities make decisions based on the risk at the local level, community level guidance that offers the public information they need to stay safe and protect others. As I said last week, we are looking at all of our guidance based not only on where we are right now in the pandemic, but also on the tools we now have at our disposal, such as vaccines, boosters, tests, and treatments, and our latest understanding of the disease. As we consider future metrics, which will be updated soon, we recognize the importance of not just cases, which continue to result in substantial or high community transmission in over 97% of our counties in the country, but critically, medically severe disease that leads to hospitalizations. We must consider hospital capacity as an additional important barometer. Our hospitals need to be able to take care of people with heart attacks and strokes. Our emergency departments can't be so overwhelmed that patients with emergent issues have to wait in line. We are assessing the most important factors based on where we are in the pandemic, and will soon put guidance in place that is relevant and encourages prevention measures when they are most needed to protect public health and our hospitals. We want to give people a break from things like mask wearing when these metrics are better, and then have the ability to reach for them again should things worsen. If and when we update our guidance, we will communicate that clearly, and it will be based on the data and the science. However, it's also important to remember, regardless of the level of disease burden in your community, there are still very important times to continue to wear your mask. If you're symptomatic or feeling unwell, you should wear a mask. If you're in the 10 days after a COVID diagnosis, you should wear a mask. If you were exposed to someone with COVID-19 and are quarantining, you should wear a mask. I know that everyone is anxious to move beyond this pandemic and some of the ways we have had to change the way we live over the last 2 years. We all share the same goal, to get to a point where COVID-19 is no longer disrupting our daily lives, a time when it won't be a constant crisis, rather something we can prevent, protect against, and treat. Moving from this pandemic will be a process led by science and epidemiologic trends, and one that relies on the powerful tools we already have, including vaccines, boosters, testing, and treatment. Thank you. I'll now turn it over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next couple of minutes is try to address for you a question that is now frequently being asked following the data that has come out from the cohorts who've been followed following their third shot of an mRNA vaccine, namely their boost. And the question people ask is, will I being everyone, need now a fourth booster shot? So let me tell you what we know so far. Next slide. What we do know is that data from now multiple studies, and I'll show you an example of a couple of these, of vaccine effectiveness show that for the immunocompetent people, a single booster shot continues to provide high levels of protection against severe disease caused by Omicron. This should not be confused with the fact that for many immunocompromised people, already a second booster shot, namely a fourth dose of an mRNA, is recommended because of what we know about their poor response to the initial regimen. And again, as I'll show you, new CDC data indicate that booster shots are safe and well tolerated. So let's get to some of the representative data. Next slide. This is a slide from the UK looking at vaccine effectiveness against hospitalization with Omicron. And you're looking at the diminution of efficacy or effectiveness after dose 2, and the time on the bottom is weeks. And you're looking at two separate vaccines, the Pfizer-BioNTech and the Moderna. And as you can see with hospitalizations, although it goes down from the initial very high 90+%, goes down to around 78 or 80%, nonetheless, it's still at a high level, relatively speaking. Next slide. This is an even larger study, a large cohort study from the CDC recently put out in the MMWR, their Vision Network. I want you to concentrate at the 2-dose vaccine efficacy at 4 to 5 months against Omicron. And again, it goes down to 58%. However, at 4 to 5 months, even though it has come down over a period of time, you could see it go from 91 to 88 to 78. Nonetheless, the level of 78 is still a good protective area. As I'll get to soon, I'll show you what that means looking forward. But I do want to mention on the next slide the safety of this, because we often get asked that. If you look at the CDC from February 11th and look at their monitoring systems, the V-Safe and the VAERS, it's very clear that for people 18 years of age or older who've seen the same mRNA vaccine brand for all of their vaccinations, they actually experience fewer adverse reactions following the booster dose than they did after the second dose. And in fact, 92% of reports to VAERS, which is all adverse events related or not, are not considered serious, and headache, fever, and muscle pain were the most frequently reported reactions. And the V-Safe data found medical care was rarely received after a booster dose. So let's go to the last summary slide. Next slide. The dynamics of COVID-19 outbreak, as Dr. Walensky just showed you a moment ago, continue to point in a sharp downward direction. Vaccination and boosting will be critical in maintaining that downward trajectory, particularly when you're talking about the red curve of severe disease leading to hospitalization. And getting back to the first question that I posed in my first slide, the potential future requirement for an additional boost or a fourth shot for mRNA or a third shot for J&J is being very carefully monitored in real time. And recommendations, if needed, will be updated according to the data as it evolves. I'll stop there and back to you, Jeff.
Thanks, doctors. I'll discuss how we're thinking about the moment we're in and our planning for the future of this virus. We've made tremendous progress in our ability to protect ourselves against COVID-19. 75%, 3 out of every 4 adults, are fully vaccinated, and 2/3 of eligible adults have gotten their booster shot. For all Americans, both the vaccinated and unvaccinated, we have strong tools, including free at-home tests and free high-quality masks that provide added layers of protection. And importantly, we have a range of effective treatments and therapeutics, including pills that are up to 90% effective at preventing severe illness and hospitalization. As a result of all this progress and the tools we now have, we're moving toward a time when COVID isn't a crisis, but is something we can protect against and treat. The President and our COVID team are actively planning for this future. As we look forward, we'll continue to enhance the powerful set of tools that we have at our disposal: vaccines, booster shots, tests, and treatments. We'll keep protecting our most vulnerable, including the immunocompromised. A vaccine for our youngest kids is on the horizon. And as always, we'll prepare for the potential of any new variant to ensure we're ready to respond immediately and protect people. Throughout this planning process, our team's been working with experts, both inside and outside of government, local public health leaders, governors,